Hi everyone, we're back today again at Conneaut Lake Veterinary Clinic, and we're going to be talking about canine cancer because that tends to be an issue that many pet owners have to deal with. So with me today is Dr. Donny Consla, who is one of the veterinarians here at Conneaut Lake, and we're going to talk first of all, Dr. Consla, about what are some of the signs that we would see as far as canine cancer is concerned.
Sure. So the signs of cancer it's very broad, because cancer can affect all different parts of the body and all sorts of different body systems. So depending on what area is affected can kind of dictate what type of clinical signs that you might see at home or we might pick up here on our exam. Any new lump or bump could be cause for concern. So if you're petting your dog and you feel a new little mass, that might indicate that it should be checked out.
We talk about that a lot. We talked about that with when we had Martin in here for the geriatric pet, and we said the importance of owners putting their hands on their dogs constantly and always feeling every conceivable point. We're the best ones probably at telling you.
Right, yeah, because you touch your dog every day. I touch it once a year maybe, I
remember one time I was down here and I think I was talking to Dr. Wendy Wade at the time, and she said she's really big on the owner giving as much information as possible because you say you see my dog once a year or twice a year, and she said you're the one who sees the dog, knows what the dog is doing. So putting your hands on the dog constantly and seeing if there's any lump or bump.
Absolutely.
Okay, good one. What's another one?
If there are any existing lumps or bumps that we've been watching or you've been watching at home, if you notice any changes in those, so any change in color, texture, rapid changes in size, anything that's, anything that changes quickly in that mass.
Okay, well, let me ask the question. Sometimes when they've got a bump, I'm brushing my dog, the brush hits the bump, and it starts to bleed or it starts to ooze something. Is that a concern, or is that just maybe could that just be a fatty lump of some type?
It depends. If you bump it with a brush or something and it bleeds that easily, to me that tells me it's very vascular, and that makes it a little more suspicious. It certainly could still be something that's benign, like a cyst or a fatty lump, but typically those aren't quite as vascular and quite as sensitive.
A lot of people, I think, find a lump and then they start squeezing it themselves. A good idea? Not a good idea, or after a few times bring them in to see you?
I'd steer clear of squeezing things. If there is a discharge or debris in there, sometimes it's helpful for us to see it so we can classify it. If it is a cyst, we can only say that by the type of fluid that comes out. So if the fluid's already gone, then we can't make that diagnosis.
Good. All right. What's another one of our possible signs?
Any like nasal discharge, especially if it's on one side and especially if it's bloody. Masses of the upper airway tend to be only on one side, so we often see nasal discharge on just one side. And then if it's bloody, that kind of tells you that whatever's going on has gotten down to the blood vessels, which could mean it's a little more severe.
Is that very common for them to have
nasal neoplasia? I wouldn't say it's super common, no, but it does happen from time to time.
Yeah, I've had some of the bumps and the lumps on my dogs, but I've never had anything coming out of the nose like that.
Yeah, it's a little less common. Usually we're thinking more, like upper respiratory tract infections and things like that. But if it's an older dog, if it's only on one side, if there's swelling on the face on that same side, then things start to get a little more suspicious for a mass in that area.
Okay. What's another possible sign?
Any, straining to urinate, bloody urine, anything that you might associate with a urinary tract infection. It certainly could be a simple urinary tract infection that may resolve with some antibiotic therapy or some changes in nutrition. But again, in an older animal, you have to have a mass on the list. And so if things don't resolve with those simple treatments like antibiotics or nutritional changes, then we have to ask ourselves, is there something going on here? And a lot of times when we get our urine sample, we always use the ultrasound, so sometimes we can even see if there's like a mass there that might be causing some problems.
Okay, you said the older animal. Should I be worried about cancer? Should I be concerned about cancer if I have a young dog?
It's less likely. So, age isn't a disease, but we know that cancers and masses and growths do occur more in older animals.
I think I saw a statistic one time that 50% of all dogs over age 10 I think die of some form of cancer that is so common with the older dogs.
Yeah, and it's just like people, if you think of older people getting sick, how often is it related to some sort of cancer?
Right.
Pretty frequently.
Yes, undoubtedly. Okay, next one.
Along with, urinations, changes in bowel movements are important too. So any straining to defecate, or if you notice a change in the shape or consistency of the bowel movements, if they're like thin and ribbon-like, that could indicate that there's something within the rectum kind of decreasing that space, and so the feces has to go through a smaller pathway, which is changing the shape of it.
Okay, what about now my dogs? I've got 4 dogs, so I'm going to be coming down here soon and getting stool samples. Sometimes the stool has a little bit of a mucusy look to it. Mm-hmm. Does that sometimes happen with dogs?
Sometimes. If there's a mucus in the stool, that usually indicates that something's going on in the large intestine. The large intestine basically dries out the feces to conserve water. So it secretes mucus to kind of keep things moving through, because if you take out all the water, things get hard and dry and don't pass so easily.
Right. Okay.
So the mucus kind of lets things go through easier.
Okay, I'm sorry to interrupt you. Go ahead.
So if there's any issue in the colon, whether it's some inflammation, infection, things like that, parasites, we can see an increase in mucus. Stress, colitis, just like people get, dogs can get the same thing. That. And you'll see a lot of increased mucus with that. A little bit of mucus is totally normal. If it's not an excessive amount.
Well, on a lot of these signs we're discussing, it could be just a passing thing, just once and something like that. So you really have to monitor that.
Right.
And see how much you're seeing it.
Yeah, like I said, it depends on the body system. So if you came to me and said, my dog has nasal discharge, well, sure, it could be a mass in the nose. It could also be a viral infection, a bacterial infection, trauma, inflammation, all these different things.
So monitor for a little while, but otherwise I might be running here every day.
Yeah.
With 4 dogs, I could be certainly finding something. So I've got to kind of keep an eye on it. It's my responsibility, obviously, to keep an eye on it and then come down if there's an issue.
Right. And if it's, if you find like a small bump and, we've checked it out and then you're watching it, if it's not changing, then, those aren't emergency situations. But, scarier things like straining to urinate, nasal discharge, bleeding from something, those are more urgent things that should be checked out versus just watching for a time period.
Okay, next sign.
So vomiting, diarrhea, again, could be caused from a variety of different things, but in the older dog we get a little more suspicious of masses and also kind of some organ failure like kidneys and liver and things like that.
Okay.
So a very vague sign, as most of these are, but should be checked out right away, and are certainly side effects of some types of cancers.
Next one.
Limping or changes in gait. So in older dogs, most common cause of limping or trouble getting around is arthritis. But in larger breed dogs and in certain locations on certain bones, that becomes more suspicious for bone cancer.
That's really with a lot of the Great Danes and the Newfies and the larger dogs like that. They are very prone to the bone cancer.
That's right, yeah. And so, it could just be arthritis, but unless we take an x-ray to, look at the joint and, get our hands on those bones and muscles and joints and everything.
Are there certain types of cancer that grow faster?
There are more aggressive types that can grow faster, yeah.
Okay. Next one, anything else?
Weight loss, loss of appetite. Again, another one of those really vague signs, but can be the first thing that you, the owner, notice at home that something is changing with your pet. And, that's kind of one of the cases where it's not like difficulty urinating. We know we have to look at the urinary tract, look at a urine sample. With weight loss or change in appetite, we kind of have to start broad with some blood work and try and funnel things in to find out where the problem is. But sometimes that's all you notice at home.
In most cases with cancer, can we diagnose it right away? It usually takes a little bit longer?
It really depends.
On what kind it is?
Yeah, on what kind it is, where it's located, all that type of stuff. Okay. Sometimes we get lucky and we can find it right away. If we do some blood work and some of the liver values are elevated and we do an ultrasound and there's a big mass in the liver, sometimes it's as quick as that. Other times, much more involved things are needed.
Okay, any other possible signs?
Foul breath, drooling, odd discharges coming from the mouth could be an indicator that there's some type of mass in the mouth. Again, all those things could be associated with dental disease, but unless we get in there and look, we don't know which one it is. Increased water intake and urination subsequently can be a sign of some issues often associated with more kidney problems, but some masses secrete certain hormones and things that cause these changes in behavior and physiologic changes.
That's hard to get a urine sample. That's
Well-
tough.
Well,
Running around with an ashtray or something like that trying to catch it is usually I always say to the vet, you've got to keep the dog for a couple hours and see if you can get it, because I don't have the
Yeah.
time for that.
and the ideal situation is that we do what's called a cystocentesis, where we use a small needle and an ultrasound to guide that needle through the abdominal wall into the bladder.
And
The
get it that
urine
way.
in the bladder is sterile, but the urinary tract, like the urethra, is not sterile. So as soon as the urine leaves the bladder, it's not sterile anymore. So whether we're working up a urinary tract infection or suspicious of a mass or something, ideally you have that sterile urine sample from the bladder.
Wow, I didn't know that.
The other benefit of that is because we use the ultrasound to guide that needle in, is we can see the bladder. So we can see if there's any thickening in the wall, if there's any masses, if there's any blood clots in there, if there's any stones. So it gives us a lot more information than just a free catch sample.
Okay, anything else as far, we're jumping around here, but let's go back. Anything else as far as the signs are concerned?
Just lethargy, general lethargy, especially in an older animal. Again, very vague, probably going to have to do more workup, but it could be the first indicator that something's not working quite right.
So my responsibility as an owner, check my dog constantly. Check all those things. If I see something, write it down, because if I try and remember, forget, that's not going to work. So write it down, and as soon as I think I see a pattern or something that has been there for couple weeks or so, I better get myself to see a veterinarian and start thinking about the diagnosis.
Yeah, monitoring, hugely important. Taking notes is wonderful. And then if it's something more concerning, like a swelling of the face or a significant lameness, where your dog can't walk, or blood in the urine, then those are more immediate things to get in right away.
Blood in the urine would really be hard to catch. I mean, to see that.
I think you would notice it.
Well, I would notice, since one of mine likes to mark my furniture, I would probably find some marking on the furniture. But normally, if they're out in the grass, that's
Yeah,
kind of hard
if
to
you're
catch
not
that.
out there with them, then yeah,
Sure.
right, it would be tough to tell.
Yeah, they always say to me whenever I have to pick up stool samples, well, which one is it? And I said, well, unless I'm out there running around and catching each one as they go, I say, well, there's something was this morning, but I wonder which one it
Yeah.
was. So it's tough. There's a little bit of responsibility there on my part.
I could see you running out with a garbage bag,
Yes, I
chasing
do
after
that. I
everybody.
usually have like foil or something, and then I have a magic marker. So I get the sample, and then I fold it up, and then I mark it with the letter of the dog's first name, and then I come into the veterinarian office and I say, okay, here's all 4 stool samples. And
Maybe we should film that process for the next episode.
it wouldn't be very interesting, that's for sure. And the cameraman would have to be chasing me. Okay, let's go on now. So now I've assumed the responsibility. I've got some ideas. I've brought some notes in. I've made an appointment. I'm going to sit and talk to you and decide what can I do now. What are some specific tests that you're going to do?
So there's a lot of different tests, and they
Okay.
all give us different pieces of information. So we'll go through one by one and kind of discuss those and tell us
Okay.
why we do them and what information we can get from them.
All right.
So one type of blood test is called a complete blood count, or you'll hear it referred to as a CBC. This looks at red blood cell levels, white blood cell levels, and platelet levels. Certain types of cancer can cause changes in these from hormonal influence, causing increases or decreases in red blood cells or white blood cells. Another benefit to this test is it also helps us rule out a lot of other things. So if we're seeing bloody nasal discharge, for example, some concern is a problem with clotting, which the platelets are responsible for. So if we do a CBC and the platelets are super low, then that makes us suspicious that there's some clotting issue, and maybe cancer isn't as high of a differential at that point.
How long does it take for the results from a CBC test?
That test on our machine takes like a minute and a half.
And do most of the veterinarian clinics around this area probably have the ability to do that in-house?
I believe so.
That's not one that's sent out then,
Yeah.
that's just generally done in-house.
Right. And sometimes we will send it out if there's like something odd on our machine, or if we want to find out, the amount of red blood cells that the animal's body is making new. Sometimes we'll send it out so we can get like a special add-on test, but usually in-house is significant.
You and I talked about this a little bit earlier, and something I think I may have shared at one of my other programs, but I had a collie and I got him when he was a year old, so I would always I had blood work done, and I'd be down here and Dr. Wade or Dr. Stanton would say, his numbers are high. And I say, well, they've been high for the last 3-4 years. I just think he is a dog that carries higher numbers. So this went on, and Cody, I think, died when he was about 11, and we always talked about that and about the higher numbers. I got a puppy. The day I got the puppy, I was telling you this, I came running down here and we did the blood work because I said, I want something to compare to all the time.
Yeah.
Such an important thing for an owner to do is, if you can afford it, is to have that blood work done as soon as you get the puppy, so you have something to compare to forever.
Right. That's having baseline numbers is so helpful. We usually recommend it when the animal comes in for their spay or their neuter, because they're already going under anesthesia, so we want to have those numbers for that procedure. But then we also have a baseline to say, you know, if you come in 3 years later and the liver values are elevated, we know, is that normal for this dog, or has it been going on for years? Did it just happen, you know? So it really is a benefit to have
I learned that lesson the hard way, because it was constant. It was constant. His numbers are high, and I said, no, I'm not going to do anything about it. It's just, it's always been like that. For like 8-9 years, the numbers were high, and they were not really elevated above that level, but they were at a level higher than the normal dog.
And so there are some conditions that cause increases in those that may be normal and related to age. So, you know, having that baseline and being able to follow trends of increases is beneficial too, which you could have probably done with your dog because you checked it from time to time, so you knew it wasn't ever, you know, going horribly high.
What else other than a baseline blood test would be some conditions? Anytime you're going to put them out for any type of surgery, you do it too. Is there any other times that you would suggest that people consider doing the blood work? I think we talked about it with Martin the last time we did a program. When they get older, consider doing that.
Right, and it's often for screening for different types of conditions that we see more in older dogs, so cancers and organ failure, basically. So we recommend it for older dogs. Any sick dog, we'll usually recommend it to try and help us, if we can't find anything obvious on our physical exam, to kind of help us localize the problems that we're seeing. We usually start with CBC, and the next test we're going to talk about blood chemistry. And that is a broad group of tests kind of all in one, and it basically looks at organ function, some metabolic values, and electrolytes.
Is that done with the same draw from the...
Right, so we'll take one blood sample and we'll split it up into different tubes, and so one tube goes to the CBC machine, one tube goes to the chemistry machine, so we're not, you know, poking the animal multiple times.
I was concerned about that. I wonder how many times you're going to poke them.
Only one poke gets us all the samples we need.
That's a good sign.
And so the blood chemistry, we'll start with kidney values. It's going to tell us, are any of those compounds that the kidneys excrete, are they getting backed up, things like that. Usually we couple that with a urinalysis, but we'll talk about that in a little bit. The chemistry is also going to look at the liver values, which you're familiar with. Usually 2 or 3 of them specifically. It tells us about, is there any irritation in the liver? Is there any problem with bile flow moving through the liver? So
as a pet owner, I come in and you do the complete blood count. Is the blood chemistry part of that, or is that something else that you would say, okay, you've already done the initial, now you're going to go to the next stage?
Usually we do those two at the same time. Because they tell us like such different parts of the story that having them, usually we need both of them anyway to kind of tie some things together.
Most veterinarians can do that in-house? Yeah.
Again, those can also be sent out, but I think most vets have the capacity to do them in-house. This one takes a little bit longer, you know, more like 15-20 minutes, because it's analyzing so many more different things.
And then you get a printout of that.
And then we can look at it and go over it. Other things that the chemistry is going to look at is some metabolic things like glucose, protein, things of that nature. And then we can also get electrolyte information, so potassium, sodium, calcium, all those types of things. And the electrolytes are pretty important when we're thinking about cancer. Several types of cancers, like anal gland cancers, some plasma cell-based tumors, things like that, actually cause calcium to go high because they secrete this hormone from the mass itself. So oftentimes when we're doing our routine screening, we'll see that calcium's high, and that kind of clues us in to, you know, look a little closer for maybe some masses that might be somewhere.
Used to be easy. You got a dog, you got the rabies, and that was it, and you never did another thing. But boy, now we're just, I mean, we bring them in a lot because we want them to be healthy.
Right. Well, and the thing is, because of advances that we have in medicine, dogs live a lot longer now.
Right.
So, you know, back in the day, they didn't always live to be, 15 years old, but now that they're living longer, we start to see cancer and stuff more often. Just like people, 200 years ago, people died when they were like 40 years old.
Sure.
But with all the advances in antiseptics and medicine and stuff that we have, people live longer, and so as we get older, things start to malfunction, and that's where these masses arise from.
Yeah. Okay, something else to confirm the cancer.
The urinalysis is kind of the third kind of initial workup test that we might recommend, and this is an analysis of the urine. So like I mentioned before, ideally we go in with the needle and get that sample. If you can bring us a sample, that's always great, just in case the dog or cat comes in and their bladder is totally empty and we can't get a sample. That happens sometimes. So at least we have something to look at. And the major thing here is we look at the specific gravity of the urine, which is how concentrated it is.
Is that the color of it?
Not necessarily.
Okay.
They can kind of be tied together, but not always. So this is how concentrated it is. So basically, the kidneys should be sucking out all the water, and you should have a nice concentrated urine because the body wants to save the water to use for different processes. If the kidneys aren't working, then that water just goes out basically unchanged. It doesn't get reabsorbed. And so if there's a low specific gravity and the kidney values are up, then that points us towards the kidneys. But there's other things that can cause those kidney values to go up that may not be related to kidney failure.
Okay.
Okay.
That's another one.
And we also can see things like crystals, signs of infection, blood from maybe a bleeding mass, and there's specific types of cancer in the bladder that produce a certain type of cell, and sometimes we can see those on the urinalysis. So it seems like such a simple test, but we get a lot of fantastic information from it.
In-house, generally?
Generally in-house. Again, we can also send it out if we see something a little suspicious.
Okay.
Especially if we're seeing, odd types of cells, then we usually send it off to the pathologist because that's their job, is to look at cells all day.
Right.
So, it may look odd to us, but they can characterize it a little further and say, this is moderately odd looking or severely odd looking, and it kind of helps us. It's just another piece of the puzzle that we can use to kind of localize things.
What's next?
X-rays or radiographs.
Is this usually the order we do them in? We're talking about now? Kind of?
I would say roughly, yes.
Okay. All right.
But if your dog comes in with like the front leg lameness, then we might do the X-ray first.
Right.
Because if we're thinking, it could be arthritis, we don't necessarily need to know how the liver and kidneys are working, unless we're going to start a medication or something. But that's another talk.
Right. Yeah. Okay.
So X-rays, kind of twofold here. This can help us work up a possible cancer. So if we're feeling the abdomen and we feel, a mass in the spleen, we can take an X-ray and confirm that mass is associated with the spleen. Or, if the animal just comes in for lethargy, we can take an X-ray of the abdomen and see, and then we see like a mass there or something.
Do you have to anesthetize them to do that?
Not always. Usually the only time we have to totally anesthetize them is if we need skull radiographs. So that would be the nasal discharge situation. And that's because there's so many fine structures in the skull and so many different bones that we need it to be perfectly symmetrical to analyze things. Because if the skull is tilted just a little bit, it can cause overlapping of all those fine structures, and maybe this one nasal passage looks totally clear, but because there's some overlapping on the other side, it looks like maybe there's something there. But it's artificial, it's not real. It's just because it's not perfectly balanced.
So you can kind of hold them in a position or whatever and just...
If they're anesthetized, they're just sleeping, so we can, get their legs out of the way, put their head perfectly straight, measure things to make sure it's perfectly straight, and then take our picture.
Some dogs, though, will allow you to do that without having to anesthetize them.
Not skull rads.
No, not the skulls, but the other things.
But other X-rays, like abdominal X-rays, chest X-rays, we very rarely have to. I don't think we ever anesthetize for that. Okay. Some dogs that might be very anxious or very painful, like if it's painful hips or something like that, like a bone tumor maybe, then we'll give them some pain medication and sedation, just to calm them down so it's not a painful or stressful experience for them. But usually for general X-rays, we don't need to even sedate them for it.
Okay, what's next?
Well, so x-rays we can use to maybe find a mass, but we can also use it to stage masses if we already found something. So often we're looking at the lungs because masses like to spread via the blood, and a lot of blood goes to the lungs and to the liver. So if we find, say, a mammary mass on your dog, we'll often recommend taking chest x-rays before we go to surgery to remove that. If we take chest x-rays and we see lots of metastatic masses in the lungs, and that changes prognosis and treatment and all that type of thing. Makes surgery a little riskier, and we have to go through all these different things. So x-rays are beneficial in that sense because it gives us more information on maybe how far things have gotten with the mass that we found.
If I'm gonna, after you do all this, before we go on to a few more things here, you said one thing at one of our things for Armstrong, and it was about, and it has stuck in my mind so much. And it was a comment that you made that whenever you decide to do a lot of these things, decide in advance what you're going to do when you find the results. Because I guess the age of the dog and the quality of life and that stuff would enter into it. That if I have a 13-year-old dog that's a bigger dog and ends up with something like this, I can do all these tests, but what am I going to do afterwards? Am I really going to let that dog go into chemo or something like that when they're already 13?
Right.
So that has stuck with me. And in fact, I've told some people that. I said, it was the most realistic comment that I ever heard, that before you decide to do all those things, no matter what it is, you should decide what are you going to do when you get the results. Because if you're not going to do anything with the results, why put the dog through all the tests unless you really just want to know for your own benefit?
And that really comes into play when we start getting into these more advanced tests and things. Like some of the basic blood work and maybe an x-ray might not be too unreasonable, because it can at least give you some idea as to what's going on. But if we find a mass and we recommend surgery with a biopsy and chemotherapy, if you say to me, well, I'm not interested in chemotherapy, and we know that specific type of mass only responds to chemotherapy, then maybe it's not worth,
doing that,
going to surgery to take it off. So you kind of have to think of the end game. Like, what are you going to do after you make this big decision? Are you going to follow up with, the radiation or the chemo, whatever it may be? If you say no, then, we can still, take masses off and things like that, but the survival doesn't really change if you're not going to follow through with those other treatments.
I had that same conversation. It had to be within the last 2 weeks, and it was someone that's a friend of mine who was, and I can't remember now who it was, and she said she was going to do all these tests, and I said, well, how old is the dog? And she said, well, the dog is going to be 13, and I said, well, what are you going to do when you know all those results? Are you going to do something or not? And she says, not necessarily, but I just to know for my own peace of mind, which is, of course, that's a huge thing. My own peace of mind, what's really happening with my dog? And I said, well, if that's important to you, then you undoubtedly have to do that.
Right, and that's kind of the other situation where people say, you know what, I'm not going to put my dog through chemo, I'm not going to put him through radiation, but I want to know what to expect. And that's realistic too. So my dog, for example, had a neurologic condition, and I kind of wanted to know how much time I had left to deal with. So we did some genetic testing, which is not a test we would normally do, to kind of work up some of these vague signs, but it helped me get a diagnosis, and I could say, based on some literature that's out there, okay, I have about 6 months left. So that's great for planning, things to do with the dog, preparing, all sorts of things. It can help you get in the right mindset of what to expect. So even though sometimes you may not do all these advanced treatments, some people just want to know, A, what's going on, and B, what to expect a few months down the road.
And how much time do I have with the dog?
Right.
And whether or not do I want to take them not to some other place to go to some type of treatment and things like that, or am I just going to let things go?
Right, because if, for example, if we see a liver mass, it could be a horrible malignant type of mass, or it could be a benign one that just looks nasty on like an ultrasound. And the benign one, surgical removal, those dogs do fine in all the studies that have been done. It's a big surgery to take off a liver lobe, but they get years of life after that. But if it's something much more aggressive, then maybe it's only 3 months. So that's where sometimes doing the advanced test does give you a little more information. But again, are you going to go to surgery with it, or?
And in reality, one of the big factors with an awful lot of owners is how much is this going to cost? I mean, if you're looking at doing all these tests and doing all this, and then if things have to go beyond the veterinary clinic to someplace in Pittsburgh or something like that, and you're looking at, let's say, $1,500, which would probably be very inexpensive. Wow, that's an awful lot of money to a lot of people. And a lot of people, unfortunately, have to make that decision based on their financial situation. And that's okay, too. We just have to realize that that happens.
Yeah, and we just have to pivot and take our treatment plan in a different direction. You know, that's not necessarily a bad thing. That's not something to feel guilty about.
Right.
You know, there's always something we can do. It's just which way do we want to go?
Yeah. Okay, another thing. What are some other tests? Keep
so
on jumping back and forth here. We're going to try and stay centered, okay? What's the next thing we can do?
So we talked about x-rays, which is a form of imaging. Another form of imaging is ultrasound.
All right.
And so that's just like, you know, what the human doctors use to look for babies, things like that. So ultrasound shows us structural changes in organs. So it's not going to tell us that this mass that we're seeing is this specific type of mass, but it will say, you know, this mass looks like it has, you know, cavities in it, it's darker than the rest of the organ, and so on and so forth. And we know through different studies and things like that that kind of can suggest certain types of masses. So it's very nice because you can actually visualize the organs and individually. You can get away from a lot of the overlapping that sometimes we have with x-rays. And so it's just a really nice tool. We can also often get samples of different masses if we've done like clotting tests to make sure there's no clotting issues. Just like we use the needle to get a urine sample, we can use a fine needle to go in and get a sample of the mass and look at the cells. And sometimes that can give us a diagnosis that way versus having to go to surgery to take off a mass or get a part of it as a biopsy. So kind of another benefit of that. And so it gives you really nice, you know, images of all the different organ systems.
Okay, what's next? What's our next test?
And speaking of getting samples, the needle aspirate or fine needle aspirate, FNA, all the same thing. So that's using a small needle to insert it into a mass. And basically the cells in that mass will get sucked up in the needle. Then we squirt it on a slide and can look at it under a microscope here or send it to the pathologist to review for us.
And we're going to show that a little bit later.
We're going to look at one of those, yeah.
Okay, then what's next on our list?
So biopsy is kind of the big brother of the aspirate, if you will. So that's where instead of just getting some cells from it, we get actual tissue from it. So we can do excisional biopsy where we remove the entire mass. So say a mammary mass, we can take out the entire mammary gland and submit that to the pathologist. Or we can do an incisional biopsy where we just take like a little wedge of it or a small piece and submit that. The difference, it just depends on where the mass is located and what we think we're dealing with. We know, say for mammary cancer, part of the treatment is getting the mammary gland out of there and spaying the dog anyway. So it makes sense to kind of do that all at once and submit it for the histopathology to have that information. If it's something, you know, like on the face or on the nose, you know, we can't just take that whole mass off.
Can't take the whole nose off. With my collie, my God, we'd be losing 6 inches.
And so sometimes getting just a piece of it to get some more information at that point to help us decide where to go. With the aspirate, you know, they can look at the individual cells and, like I said, tell you how odd they look or, you know, suggest what it might be. The biopsy is like the definitive thing. It will tell you what type of cancer it is, the stage of it, how severe it is. That will give you the most information.
When you do the aspirate, is it that's only for surface things, or can you also? You said you can also do that with the ultrasound and go into like the bladder.
Sometimes we can do it for internal masses too, if they're close to the surface. So in the body cavity, the spleen kind of rests up right against the bottom, so it's right there. So sometimes, you know, you can poke masses like that, you know. But if it's something really deep, like a deep lymph node, we may not be able to get access to that because our needles are only so long, and there's a lot of other important things in between your probe, the dog's body wall, and the mass that you're looking at that's deep.
Okay, what's our next choice?
So from here we start to get into, you know, the much more advanced testing. So some more advanced imaging would be CT and MRI. CT is really good for bone-related things. When we start talking about stuff in the skull, CT is kind of the gold standard, just for looking at, you know, bony changes in the nose, all sorts of things like that. MRI is kind of more sensitive for soft tissue. Just like humans go through these two things. Right.
Do some of the veterinary clinics have that ability?
No. Your basic vet's probably not going to have the ability to do a CT or MRI. So this is more of a referral test.
So it can be referred to Cleveland or
Pittsburgh, Akron. Those are the two closest ones around here. Metropolitan Veterinary Hospital in Akron, and Pittsburgh Veterinary Specialty.
The one right there on 279.
Right. Yeah.
One of my favorite places.
Yeah, it's a pretty cool place.
Yes.
I did a lot of my externships there, and they do good stuff down
there. A lot
of
people probably have seen it and don't realize it, but when you go down 79, you get on 279, the Camphorn exit right there where Giant Eagle and Home Depot and all that. If you look back just a little bit, huge building.
Yeah, it's like on the hill. It's very nice.
Very nice. A lot of specialty things there.
Right. And, they deal with all this advanced stuff all the time, so they're very well suited to, make diagnoses and things off of that.
Okay, anything else?
And finally, we can get into some cancer-specific tests. Again, these often occur probably more at like the oncologist level versus at the general practitioner, but it's good to know about them so you kind of have it in the back of your mind. So let's say we're dealing with lymphoma. We felt some big lymph nodes here. We took an aspirate in-house. We looked at it on our microscope and we saw all these horrible-looking cells. So we send you to the oncologist for chemotherapy. Lymphoma is extremely treatable, so that's one where a lot of people actually go through the chemo. And they can do specific tests to find out what type of lymphocyte is causing the lymphoma, which chemotherapies it's reactive to.
Are there a lot of vets that just deal with, they're oncology vets, that just do cancer treatment and that's it?
Yeah, they're veterinary oncologists.
That's what they do?
Yeah.
Wow.
Yep, that's all they do. And there's, like radiation oncologists and more like clinical oncologists. So you'll see one of the two. Usually the more clinical one first, and they'll help work it up. And they do all like the chemo and stuff. And then if the animal needs radiation, it goes to the radiation oncologist.
Oh, before we talk about all these treatments, one thing I wanted to mention. Again, I think there was a program that I did up at Canberra. And I want to say it was Dr. Stryker, and I could be wrong on that, but he talked about a study that was being done by the Moores Foundation because Golden Retrievers, we talked about the Newfoundlands, we talked about the Great Danes, but Golden Retrievers have a heck of a high incidence of cancer. And I think they were doing any dogs that were anywhere from 6 months to 2 years of age, and they get them in this study and they're trying to find out why is cancer such a huge issue with Golden Retrievers. Anyone who has a Golden Retriever could certainly call up to Canberra because I know that they're one of the main places for it. But they do work with the Morris Foundation. It's something that some people that are owners of Goldens might say, I got to check this out and see if I can get into the study. So,
yeah, there's a lot of breed-specific cancers, and just like there's a lot of breed-specific diseases, because when breeding we select for certain physical traits that manifest internally as certain genetic traits as well.
Right.
And so by selecting for a long snout or something, you're inadvertently getting the genes that also carry, say, like lymphoma or something.
Right, we've done so much of that.
Right. But, even in mixed breed dogs, there still is cancer. So that's not to say that mixed breed dogs are cancer free. If you, have a mixed breed lab and you never get it spayed, the chance of mammary cancer is still going to be super high, So all those things to consider. But, if a Schnauzer comes in with bloody urine, transitional cell carcinoma, which is a bladder cancer, is going to be really high on the list because that's a specific type of cancer that they get.
Yeah. Let's bring the dog in and let's aspirate, and then we'll come back and talk about the different treatments.
Sure.
All right, we'll do that. All right, we're back here. We've just brought Jed in so that we can do and show everyone what it's like to aspirate a lump on Jed. And helping us is Shelley. She works here at Conneaut Lake Vet as a technician, correct?
Correct.
And the dog belongs to Tracy Ingram. We better give Tracy a little bit of a plug here because everybody knows Tracy. She's the person that's the receptionist out front that many of you know. So this is her dog. How old is Jed?
I think he's about 9 years old now.
Okay.
And so Tracy brought him in for us to do a little demo on. So you can see he's got a lot of tiny little, fatty looking lumps all over the place. We can say that they're probably fatty just by feeling them, but unless we do the aspirate, we don't really know.
But he's got so many. What would you do? Aspirate every one of them?
Yeah, and usually when you bring your dog in, we mark it on a lump chart.
Oh, yes.
And we monitor the change over time. And sometimes people will just opt to monitor them. And then if one starts to get bigger all of a sudden, then we say, all right, let's get a sample of that one because it's changing.
Right.
Which is one of the things we talked about you watching for at home.
Absolutely. And it's funny, whenever I've come in and we've had the chart with one of my dogs and we start looking and Dr. Wade and I are looking, I'll say, I know it's here somewhere. And all of a sudden, a year later, we can't even find the lump. So that's something too. So, okay, and what are we using here to do this?
Okay, so I have some small gauge needles. I'll take the cap off here for you. So you can see, pretty small, not too traumatic. We have a syringe and some glass slides that I've cleaned for us. So like I discussed before, the goal is to get some of the cells that are in this mass into the needle, which I can then push onto the slide so we can look at them under the microscope or send them off to the pathologist to look at.
And my first comment to you was, my God, are you going to take 4 of these? And your reply was?
And it really depends on what we're suspicious of and what material we get out of it. So if I get, like a really greasy material out of it that would be characteristic of a fatty mass, then maybe only, 2 is sufficient. If it's, maybe like a lymph node or something like that, then we're going to take a lot more samples so we know we get a good amount of cells on the slide for the pathologist to look at.
Take, just put the needle in once and then just keep on changing that other section? Or no, we're going to put a needle in every time. 4 needles. Oh.
Yeah. But he's not going to get poked that much.
Okay, good. That's okay. Well, I'm a little concerned about Jet here.
Okay.
All right, here we go.
All right, so here we go. So Shelly's going to restrain for us. Usually they don't even react. It's such a small needle. So I'm going to grasp the mass here so I know that I'm poking only the mass because I don't want to poke, some other fatty tissue that's in the area because then we get false results, okay? And so I stick the needle in. You can see he did not react at all. He doesn't even care. I'm kind of moving the needle in different directions so I can get all different parts of this little mass.
So you're picking up something every place you're moving it to.
Right. And so now presumably there are cells in this needle at this point, okay? So then we come over here. We get some air in our syringe.
Can you turn a little bit so they can see what you're doing? There we go.
Attach the needle to the syringe. And then I have my slides here that are prepared, and I'm just going to squirt the material that I got from the mass onto the slide, okay?
It doesn't even look like you got anything.
Oh, well, wait till I bring it up. So if I hold it up, do you see the material on there now?
Oh, I do now. Okay. My gosh, it's such a small amount.
And that's actually a good amount for this type of diagnostic.
Okay, so you did it. Now what have you decided? We need to do another one?
Well, then we take another slide and we're going to smear it out.
Oh, okay.
Because if I sent this to the pathologist, it would just be a thick blob of all sorts of stuff. So we want to get it in a single layer.
Oh, so the 4 slides I saw, there wasn't 4 samples.
Right. So now it's much thinner, the sample.
Oh, okay. Gotcha.
Okay.
All right.
So I can tell just by looking at this that it's probably, not definitely, but probably a fatty mass. It has this very greasy and oily appearance to it, which is very characteristic of a fatty mass, because fat, think of like Crisco or something, it's greasy and oily, right? And that's what this looks like. If you touched it, it would have that same like greasy, oily feeling to it. Now, looking at it grossly from this distance is not sufficient to be diagnostic. So what we would do now is we would go and stain this and look at it under the microscope.
Okay.
And as long as we see fat cells, then we can say most likely this is a benign fatty mass. Again, the only way you can get a definitive diagnosis is with a biopsy. But for things like this, doing the cytology is sufficient.
Do I do one more?
We can do one more.
Let's do one more and just do it one more time and just explain to everybody again what you're doing. So you're taking the needle, you've got the needle now, and you're going to go in with the needle.
So we'll do one of the ones that's on his side here, underneath your arm. So we've got this little mass here. Again, it feels soft. I can move it all around. It's not deeply attached and like invading the muscle underneath. So I stick the needle in, move it around. trying to get as many cells as possible.
I hope our cameraman is getting a good side view picture here of Jed, because he should be a star.
He's handsome, isn't he?
I think he is. He's a good-looking dog.
Then we're going to put the sample...
We don't want to tell Tracy that it's a good-looking dog. We'll just pretend like we're not going to say that to her.
Okay, again, you can see we got that greasy-looking material, and this was
a
different mass this time, but still the same looking material.
Now that looks a little bit different than the one you did before.
You think so?
Well, maybe my eyes are focusing better. I don't know. Maybe you held it closer with my farsightedness.
Maybe. And so
maybe
again,
that was the difference.
I'm going to smear it out so it's a single layer, so we can really get a good look at the individual cells.
Oh, okay, I can see.
So it's even harder to see because
Sure.
it's just a single layer now, and it's clear.
Okay. And that's how you aspirate.
And that's a fine needle aspirate, and then the cytology portion, which is a must after you do this. Like I said, you can't diagnose anything from this, but would be using a special stain to look at the cells under the microscope.
Do you put another piece on top of that?
Nope.
Oh, just like that. Now,
Yeah.
it's not going to get contaminated or
Well,
anything?
we let it dry, air
all
dry.
right, all right.
And the amount of bacteria that would fall on it from the air is
Not that much.
inconsequential. It wouldn't make a difference. So you probably wouldn't even see any on the microscope.
Is there anything else we should remind people about as far as this is concerned? Obviously, Jed didn't really care.
I mean, I think the important thing is, you think about sticking a needle into something, you're like, oh, that sounds awful, especially when I'm putting it in and moving it different directions. But I mean, you can see he just
No,
stood
he
there and
didn't
was
care.
like, whatever, he didn't
Yeah.
care. So it's relatively non-invasive, it's not really painful, and we can get a lot of good information out of it.
Okay.
Especially when it comes to things that we're suspicious that are benign. This is a much less invasive thing we can do to confirm that.
Okay, good. Works.
Okay.
All right. And we will let Jed go, and he's now been a star for Armstrong, and we'll come back and talk about the various treatments that are available for cancer.
Sounds good.
Thanks, Shelley, for helping us. Appreciate it.
You're welcome.
Okay. All right, we finished doing the aspirate with the needle for Jed, and now we're going to talk about the various treatments that are available. So what are some of the ones that I would have an option of as a owner to choose?
Sure. So just like human cancer, kind of the big two are chemotherapy and radiation.
What about surgery?
Yeah, and surgery.
Okay.
And then something called metronomic chemotherapy.
Okay, let's start with surgery.
Okay.
That's an easy one.
So surgery is basically going in and taking out the entire mass or the bulk of the mass. The goal with this is to get rid of any cancer cells that are there by physically removing them from the animal.
Depending on location.
Depending on location.
And if anything else is involved.
Right.
Okay.
So oftentimes we can do that here if it's like a mammary mass or a mass on the spleen. If it's something, like a mass on one of the liver lobes or a kidney, that's something that a boarded veterinary surgeon would have to be involved with. But oftentimes the stuff that we find we can take off here at your regular vet.
And how long is recovery for something like that?
It really depends, but I would say on average it's similar to a spay. Oftentimes it's going into the abdominal cavity to remove an organ or a mass or something like that. So 10 to 14 days.
Okay, how long do they usually stay at the vet's office?
Usually 1 to 2 nights, depending on where it's at. If it was, like a mammary mass, 1 night. If it was a spleen, usually 1 night, maybe 2.
And then depending on its location, they get to go home with a cone of shame.
Yeah, always.
Always the cone of shame.
Always.
Worse for the owner, I think, than for the dog.
Yeah, it is. You come in with bruised knees.
I did. The back of the leg is like,
Yeah.
oh my God.
To
I've been
replace a
dis-
coffee
oh my
table or
God.
two.
Absolutely. Okay, what's mine? So we've done surgery. Surgery was a choice.
And so depending on what the mass is, if we do surgery, we're going to send it off as a biopsy for histopathology to find out what it is, what we're dealing with,
Okay.
where do we need to go to next. For example, if we take off a mammary mass and it comes back benign, we don't need to do anything else. The surgery was curative. It did everything that we needed to do to take care of that specific mass. If it comes back as something more malignant, we may need to do some follow-up, and that's where the chemotherapy and the radiation come into play.
Okay, so we do surgery, and what if we don't get the outside areas?
Chemotherapy or radiation.
And you would know that because you sent that to them, and then they say maybe on the edge here there was a little bit.
Right. Yeah, they say, they'll tell us, because like I said, biopsy and histopathology are like the definitive, give you the answer. They'll say, it's this type of tumor, it's this stage, and all the margins are good except for maybe this one.
Okay.
Or all the margins are totally clean, you got it all. And depending on what it is, and we'll know because we sent it off, we can say, you know, even though we got it all, we still should do this because it's very aggressive, or because maybe there is a margin that there's still some cells, we'll want to do this, vice versa.
Okay, choice number 2, chemo.
So chemotherapy is an injectable medication that most of them all attack rapidly growing cells.
Okay.
So cancer cells are rapidly dividing because they're just growing unchecked. Normally in the body there's kind of a system of checks and balances to make sure that if a cell isn't perfect for its job, it just dies off. With cancer cells, there's not that system of checks and balance, and so these kind of mutated cells just keep growing and growing. So the chemotherapy agents will basically shut down that cellular replication.
Can you do that? Can a veterinary clinic do that?
That's more of a specialist type of thing as well.
Okay.
There's so many different chemotherapy protocols, and just like in human medicine, they're always changing as more research and stuff comes out. Somebody whose sole focus is cancer should really be the one kind of picking those protocols.
Could you maybe end up going to, let's say down on Camp Horn Road, and then seeing the oncologist down there, and then they say, well, we're going to do maybe pills or something like that, then that can be administered maybe by the owner, but maybe here or something like that. So there could be a combination of various things as far as administering the chemotherapy.
Right. And the oral pill-based chemotherapies are often what we call metronomic chemotherapy. And the goal of those is not to completely shut down the cellular replication of the cancer cells, but it's more to choke off the blood supply of the tumor. So it's not really going to get rid of any of the cells that are there. It's not really going to shrink it all that much, but it'll stop it from growing. So
you're buying time.
You're buying time.
Okay.
And so sometimes when people don't want to do full-fledged chemotherapy or are unable to, because it is a very big investment time-wise and financially, and all these different things, sometimes we can do that, and we can often do those at your local clinic. It may be a medication that's similar to something we would give for like joint pain. Some studies have shown that those same medications can affect the growth of tumors. It also depends on what type of tumor it is too. So there's a lot of factors, but that's another type of chemotherapy. It's not as aggressive. It's not going to shrink tumors or anything like that, but it can buy some time and make the animal more comfortable.
Okay, so we've had surgery, now we've had chemotherapy, and what's the other one?
Metronomic chemotherapy is kind of like a subset of chemotherapy.
What's our third choice?
And radiation therapy. So that's going to use radiation waves to attack those rapidly dividing cells. And those are often more for things, we can see grossly on the outside of the animal.
A lump on the leg?
Yeah, like a big, nasty tumor on the face or something like that. That just the chemotherapy agents aren't going to have good penetration to.
Okay, who does that? Back down to
the radiation oncologist.
Akron or someplace like that.
That's right.
Are there any other choices? Is that just about it?
Those are the main ones.
Okay, so I've come in. You've told me all this. We've done all these tests. I've just I look in the mirror and I see dollar signs in my eyes because I've just spent a lot of money and we have done some of the stuff. Or all I care about, can you make my dog comfortable?
And so that's kind of
without doing any of these other things.
Right. That's
can we just do something else?
Another alternative that we have is just to keep him comfortable and happy. And so we can do pain medications to make sure that he's not suffering anything like that. If he's not eating well, maybe some appetite stimulants, and just to keep him comfortable, happy, as long as we can. And if we've done some of these tests and we know prognosis and timelines and things, then we have something in our heads to say, okay, we've got 6 to 12 months. Let's keep him comfortable for that period of time. These are the things we need to watch for as far as progression, and just kind of play it by ear.
As an owner, should I take a little bit of time, a couple days or whatever, to make up my mind instead of telling you right away what I want to do? And
I mean, if you know what you want to do,
Then
then
do
go for it. But there's nothing wrong with taking a little bit of time and considering all these options, because it's a lot to take in all at once. And so much of it depends on what type of cancer it is. Like lymphoma, very treatable. Not curable, but very treatable in dogs. And so that's often ones, if people are interested in chemotherapy, I'll just say go for it, because the chances of a good outcome are so high. There's other ones that, we could do every treatment in the world, and the prognosis is still not that good. So.
And it's okay to do nothing. That'd be my choice.
Yeah, as long as we do something to keep them comfortable, so they're not suffering, then absolutely.
Is there anything that you can think of, since we've given an awful lot of information here, that we've neglected to tell people?
I think we've covered an awful lot.
Okay. Anything else? Just just give it their best shot and get as much information as they can.
Yeah, just be vigilant. If you notice any changes, it's never a wrong move to come in and get it checked out. When it comes to these types of things, it's always better to be overcautious than undercautious.
Sure.
Yeah.
Okay, again, Dr. Donny Consla from Conneaut Lake Vet, and we appreciate your help and appreciate the help of Shelley, and of course we had Jed here, the German Shorthair Pointer, doing when we did the aspirate. And if they have any questions, they should certainly contact their veterinarian.
Absolutely.
And check it out and see if make sure they're giving their dog the best life they possibly can and they can afford, because that's real important too. Okay, thanks very much. Appreciate it. See you again next time.